are you?
I'm good. How are you?
I'm good. I'm Haley.
Nice to meet you, Marley.
I'm going to be interviewing you today.
Okay, great.
Just asking a couple questions. So first off, can you indicate why and how your interest in nursing developed?
So I originally wanted to become a dietitian, and the main reason was because I just felt like there was a lot of ways in America our diets could be fixed, and I was more concerned with just like out of hospital, like very one-on-one with the patients, like caring about them individually. I started looking more at the profession, and I kind of shifted into nursing because I felt like that was a little more catered to patient care.
Okay, what have you done so far to demonstrate your commitment?
Yeah, so I actually got certified. I became a certified nurse assistant just because I wanted to be able to get some hands-on experience before starting the career itself.
Okay, how and why did you choose your major?
I chose it because it was most aligning with nursing. I couldn't exactly do nursing right away just because by the time I decided I had too much credit to be able to change my major to that. So health science was the best major to get all my nursing prerequisites.
Okay, how has health science benefited you personally and professionally?
Yeah, I would say it's definitely benefited me. It definitely opened my eyes up to sciences. I didn't know that I liked them. I went into college with the perspective that I'd do anything but science. And I actually love learning about science. I love learning about the way my body works and the way that different systems function. And then I would say professionally, it's just opened up a lot of doors just to explore connections through professors and other students who are in the same major as me.
Oh, awesome. What's been your favorite thing to learn so far?
I would say anything biology related, so I really like anything related to cellular respiration or just very specific to the cell, the way that things function.
Oh, awesome. Okay, so describe your ideal life in 10 years. What are you doing? What's your personal life look like? What are you working on?
So in 10 years, I will be 30. I would like to have a kid by then, be married. And then I guess professionally, my end goal is to be a nurse midwife. So maybe I'll still be in school for that. Maybe I'll be done, but kind of like working around that.
Okay, what made you want to be a nurse midwife?
Yeah, I think my sister's 9 years older than me. So I saw her have a lot of her babies, which was just like very eye-opening to me, to just the process and how beautiful it is. And I also think as well, I do think that women's health is not always, it can be under-researched in America, and I think that there's a lot of ways that specifically in the birthing process that women's voices aren't heard, and I want to be a way to just let women be respected in that process.
Yeah. Okay, describe a time something negative happened to you or you kind of went through something a little bit difficult, but in hindsight you can view it positively and how you can.
Yeah, I would say in high school I really struggled just with like friend groups and just dealing with people that maybe weren't the kindest. And I think I did have to remove myself from a lot of different people. But what that taught me in turn was that having integrity and just keeping a clean conscience throughout difficult situations is always better than being negative.
It's a good attribute.
Thank you.
Okay, how would you describe your leadership style? And can you describe an example of when you had to adjust your leadership style to address the needs of a group or situation?
I would say that my leadership style would be, I think I could be a strong communicator, I could say that. I would say I used to struggle with being a little bit more passive and letting people, or not saying what I want to say. And so an example where I had to kind of adjust that was recently I had a roommate who was a little bit difficult, and I had to be very clear and communicate when it was difficult, just some boundaries we had for our household.
Yeah, sometimes you definitely have to be straightforward.
Definitely.
Okay, so which do you think is a more important quality for a good health professional? To be an independent thinker or to be a team player?
Definitely a team player. I think that goes without question. The health community is always growing, researching, learning, and the more that we rely on each other, the more that we can grow.
Okay. Describe a time when you had a conflict with a teammate and how did you resolve it?
I remember in high school I was working on a school project and I really struggled because basically the project was we had to paint an entire canvas that was probably as big as this table, and we had just some people that were not gifted artistically and then some people that were really gifted artistically. So what I was able to do was kind of just delegate different assignments to what people were gifted at, and instead of getting frustrated that they weren't good at the specific thing I wanted them to do.
Okay. How do you handle criticism from others?
I think I generally take it pretty well, but I think it can also depend on how it's given. I try to stay, level-headed when people approach me, just because obviously we're all different, and if we were all the same, there'd be no diversity, there'd be nothing of substance. So I understand that, people having differences and bringing it up is important. And at the end of the day, criticism is usually because there's an area where someone is lacking that we can grow in.
Okay. What do you think makes someone an effective leader in healthcare?
I think in healthcare specifically, it's kind of similar to just any business. The higher you get up, the further away you can get from your goal. And I think in healthcare, it's important for leaders to remember why they started being in healthcare in the first place. And I think keeping, your love for people, caring for people, keeping people healthy. I think when you keep those values at the core, you can lead from just a place of truly wanting to do good for people and not worrying about any greed or money or legal issues or loopholes to things. So I feel like that's the most important aspect from a healthcare position.
Okay. What do you think you've learned about yourself during your education?
I think I've definitely learned that I desire to learn things that make an impact. And so I do struggle in classes that don't feel important in the moment because I want to learn things of substance. And I feel like that's something that I kind of take with me in every area of my life, as I want to feel like I'm making a difference in doing something that matters.
Okay, that makes sense. What personal qualities are you currently trying to improve?
Right now I'm definitely trying to improve procrastination and work ethic. Those are two things that I struggle with, specifically right now just because I'm taking 4 online classes. So it's not the same as, having to get to school at a certain time and your teacher's teaching everything. Everything's kind of on me right now. So I can definitely tend to get a little bit lost in what I'm doing and get off track. So that's something I'm actively trying to work on, is just staying on track of my things and not procrastinating my work.
Yeah, I think that's a big thing for a lot of people these days.
Definitely.
Okay, so these are more of like situational questions.
Okay.
So, if a patient is nervous and refuses a procedure, what would you do?
Yeah, I would definitely, obviously a patient is, their say always goes first. And so at the end of the day, as healthcare providers, we're worried about their health. So we just have to pick the option that's healthiest for them. But if they're refusing care, we have to respect that. I think it's important, just from a healthcare perspective, that we do remind them of just the things the reason that they may need the procedure. For example, if they have a hole in their heart, we do have to inform them, you will die if you don't get this procedure. Whereas there's other procedures that may not be as life-threatening. But at the end of the day, my goal is to just inform people of the healthiest options, and at the end of the day, it's their choice to decide.
Yeah. If you notice a coworker making a mistake, how would you handle that?
I would definitely consider my place. If I'm new, then I probably wouldn't tell them, what they're doing is wrong. I may check and make sure that I know what I'm talking about. But if I'm in a position where it is appropriate to correct them, I would approach them and maybe ask them about what they were doing and ask them how they do it. And then if I do see that they're doing it incorrectly, I can correct them kindly. And then obviously if they don't listen, I can go further and talk to someone higher up.
Okay. If you witness unfair treatment of a patient, how would you react?
It would definitely be concerning. It's kind of like if you work in childcare, there's certain ways you have to treat just people who are vulnerable in a situation. So when someone is sick, if they're elderly, if they're a child, it's important that we are not only just doing what needs to be done, but also going above and beyond. So if someone is treating someone poorly, that would be a pretty big issue, and I would definitely speak to someone who is higher up, for sure.
Okay, so I think that's it for the situational questions, but just a couple reflection questions.
Okay.
What values are most important to you?
I would say the values that are most important to me, a big one that pops into my mind is integrity. So just being authentic no matter what situation you're in, whether that's in a room with a patient, whether that's alone when you're charting things, whether that's in front of your boss or in front of your coworkers, staying the same and being consistent is definitely the most important thing to me.
I like that. How do you want patients to remember you?
I definitely want them to remember me as someone that made them feel safe. I want people to be able to come. I'm just imagining if I'm helping women give birth, I want them to feel heard, I want them to feel supported, and I want them to feel confident in what they're doing. I don't want any woman to be under my care and feel like they couldn't speak up or they couldn't say that they were in pain. And yeah, I just want to give women an experience where they come out of that seeing the beauty that I see in birth.
Yeah, no, that makes sense, especially because in places like that, safety's huge.
Mm-hmm.
It's a big place of like vulnerability.
Yeah, definitely.
Okay, and lastly, what do you think makes you unique? Very broad, I know.
No, that's a good question. I think what makes me unique is that I haven't dreamt of being in the healthcare world for my entire life, but I have qualities that fit someone in the healthcare world. And I think a lot of people in healthcare maybe have a family member or they've dreamed of doing it since they were little, but I kind of just realized that the job fits me really well, and I like being in a place that I can use my attributes